Good morning, everyone, and welcome to our December Management Forum. How this year has flown by. Um, we have we have several important things to talk about today, and what I'd like to do to start is to introduce Susan, um, who may have some opening words, and also uh, talk talk through the land acknowledgement statement to start us off today. Susan.
Thank you, Brent, and good morning, everybody. Happy December. I hope you're really looking forward to your upcoming holidays and staying warm and dry during these very stormy days. Um, I'm really pleased that we have Dr. Winston and Terry Saltz to talk with us about everything related to the COVID pandemic and the prodigious amount of capital work we have going on the campus right now. But first, I wanted to read the Ramatish Ohlone land acknowledgement. This is now a policy of the Department of Public Health that at every meeting with more than 20 attendees, at least once a month, we read this very important land acknowledgement in order to respect and pay homage to the people who occupied this land before we did. So I'm going to go ahead and do that. The San Francisco Health Commission, the San Francisco Department of Public Health acknowledges that we are on the unceded ancestral homeland of the Ramatish Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land, and in accordance with their traditions, the Ramatish Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramatish Ohlone community and by affirming their sovereign rights as First Peoples. All right, with that,
Great, thank you.
I'll go ahead and introduce, I think, Lisa, you're going to go first this morning.
And before you start, Lisa, I just want to remind people that we have the Q&A open in the WebEx, so that if you have questions, please put them there. If for some reason you can't, the functionality isn't working, you can send me emails directly, and we'll answer the questions as soon as we possibly can. So with that, I'm sorry to interrupt, but Lisa, please.
Well, hi everyone. Good morning. Here is our monthly Management Forum COVID update. So I'll start with some of the things that are going on epidemiologically. And just thinking about where we are in the United States, unfortunately, cases are rising substantially. I think many people have probably been talking with friends and family in other parts of the country, but cases particularly going up in the Northeast. Cases are also increasing in California, although not quite so dramatically. And I'm sure many people saw the news yesterday that the indoor mask mandate has been reinstated across the state. It's estimated that about half of Californians have been living in counties that still had a mask mandate, including, of course, in San Francisco and most of the Bay Area counties, although not Marin. But now all counties in California will be under the mask mandate starting tomorrow, December 15th, at least through January 15th in indoor areas. Cases, fortunately, are rising less in the Bay Area than they are across California as a whole. But the effective reproductive rate is higher than 1 across all the Bay Area counties. And so we do expect that we will be seeing some increases. So really appreciating everyone's attention to all of the measures that we have become so good at following. The case rate in vaccinated San Francisco residents is still about half of that in those who are unvaccinated, so providing protection against infection, and also continuing to provide very substantial protection against hospitalizations. And I'm sure people are also following the Omicron news, which has been reported in more than half of US states. It's really pretty much assumed that it is everywhere, kind of across the globe, and rising rapidly. But notably in the US, most of our cases are still due to Delta. So turning to Omicron, as I mentioned, it is spreading rapidly. We've been getting a lot of data from South Africa in the UK. And the UK just released some really interesting analyses looking at household transmission based on their routine contact investigations. And they are estimating that household transmission is about threefold higher with Omicron than it is with Delta. So pretty impressive in terms of how transmissible Omicron appears to be. They do note that that comes with a number of caveats. A lot of those analyses are from unadjusted data, and they've been surveying much closer in folks who are expected to have Omicron, which may be influencing some of that data. But it does look like Omicron is quite transmissible. What do we know so far about severity of disease from Omicron? Well, I would say we don't know a lot, but what we do know so far has been fairly encouraging. It looks like even though cases have been rising quite a bit, that hospitalizations have really been lagging. So the hope, of course, is that even though Omicron is very transmissible, that it will prove to be less severe in terms of the disease that it causes. I would just say, though, that, I think that's something that we're still waiting on more data. So how are the vaccines working against Omicron? Well, I would say that, we have some less good news and some better news. So again, from the UK, folks who have gotten 2 doses of Pfizer vaccine, which of course we've used very widely here, or 2 doses of the AstraZeneca vaccine that's used widely across the globe and is the very similar to the J&J vaccine, had really pretty limited protection against getting infected with Omicron, estimated at maybe somewhere around 30% protection in terms of infection. Although the protection rates against hospitalization and severe disease may be substantially higher. But in vitro, the laboratory studies have been much more encouraging. They're still early, but they suggest that if you get a booster dose, so that 3rd dose, that it really substantially improves the immune response to Omicron. So please, please, please encourage everyone. Vaccinations are good, and we should all be getting our boosters once we are eligible 6 months after the 2nd dose of the mRNA vaccine. And just to note, only about 61% of Americans are fully vaccinated. So we really do have a long way to go on the vaccination front. And then, I did want to end with something that is more positive. So I want to talk about therapy and prevention, because we do have a couple of things on the horizon very soon that look quite promising. So people may have heard about the AstraZeneca long-acting monoclonal antibody that may actually work for as long as a year. And this is given for pre-exposure prophylaxis, so to people who don't have COVID, who haven't been exposed to COVID. but they're immune compromised and suspected that they may not mount an immune response. And that is looking really good. So we may have a really nice option that will last for a long time for people who are not expected to mount a response to the vaccine. So we will be looking at administering that here as soon as it starts being distributed. It may be initially going to bone marrow transplant and solid organ transplant centers, so we may not be able to administer it here right away. But it's as soon as it's available, we'll try to start making that available for our patients who qualify. And then 2 antivirals to talk about today. So I think one we discussed last time, and that was molnupiravir, which is an oral antiviral that has already been reviewed by the FDA Advisory Committee and was approved and may get emergency use authorization from the FDA as soon as the end of this week. This is for mild to moderate disease. It's not quite as good as we originally hoped. It may be about 30% effective at preventing the combined outcome of hospitalization and death in people who are at high risk, but it was actually substantially better at preventing death. And it looks like that will be our first oral antiviral that will be available. But close on the heels of molnupiravir is a drug from Pfizer called Paxlovid. And they have a major press release out this morning that's getting a lot of people very excited because basically it confirmed their earlier announcement, which looked very promising. So this is also an oral antiviral given within 5 days of symptom onset, so you have to give it early. Pretty big study, more than 2,000 patients. And it was 88 to 89% effective in preventing the combination of hospitalization and death. And in fact, there were no deaths in people who got the Paxlovid compared with placebo. And in a second ongoing study that was in high-risk people, it was about 70% effective in reducing hospitalizations, and there were no deaths compared with placebo, and that study is ongoing. So we are looking forward to having more options for people who do wind up getting COVID. Hopefully these will be breakthrough infections because hopefully everyone will be vaccinated and will get their boosters. But we may have some substantially better options in 2022. So those were the things that I was planning to mention. So I will stop there, and Brett, please let me know if there are questions. Thanks a lot.
There are. Thank you so much, Lisa. So you mentioned the study of the AstraZeneca vaccine's effectiveness with Omicron. What about other vaccines, Pfizer, Moderna, and so forth?
Yeah, so those of the studies were from the UK. So just to be very clear, you know, we can't really do vaccine studies in the US yet, looking, you know, to see what the risk is because the number of cases that's being reported is not that high. But in the UK, where the virus is spreading rapidly, the 2 most common vaccination schemes that they use a vaccine from AstraZeneca that's a 2-dose vaccine that's like the Johnson & Johnson vaccine. And then they also use the Pfizer vaccine, which is the same vaccine that we use. Neither of those given as a 2-dose combination was fantastic at preventing infection with the Omicron variant of COVID. So they both looked like if you only got 2 doses, that you only had about 30% protection compared with people who hadn't been vaccinated. These are very early studies. I think people are aware we had already seen waning in protection against infection with Delta for just getting 2 doses of the vaccine. So it looks like 3 doses works better in general, and that may be especially important for Omicron.
Mhm. Um, eh, can you foresee a time when we'll be developing uh, vaccines specifically targeted to different variants?
Yeah, so the companies are well on their way with that. So both Moderna and Pfizer have been developing new vaccines looking at the variants. Of course, the variants keep changing. It remains a bit unclear how necessary it will be because, for example, after the so people talk about this a lot with Delta. Were we going to need a Delta specific vaccine? But it turns out that giving the booster seems to work really very well. Of the original vaccine, seems to work really quite well against Delta. So I think we're going to have to see how well 3 shots works against Omicron. But if it's not working particularly well, then I think that will likely get talked about a lot. And but the technology is there. The vaccines can be updated relatively easily to be more specific.
So, do you have any sense of what hospitalizations are going to look like uh, early next year here in San Francisco?
Yeah, great question. I have to say, so far we've been somewhat encouraged. I think we were pretty worried what would happen, after Thanksgiving. We're now 2 weeks after Thanksgiving. And we have, last year we were really starting to see a huge increase in our numbers that, came right after the Thanksgiving holidays and really just escalated through Christmas and New Year's. So we kind of peaked towards the end of January in 2021. It's looking better right now. I think most people think that with cases increasing, we probably are going to see an increase in hospitalizations. But how much that's going to be balanced by are many people in the city who have been vaccinated, particularly high risk and older folks. And then, hopefully people are getting their boosters, particularly people at higher risk for hospitalizations. So, right now, even with the cases going up, we have not as yet seen an increase in hospitalizations. We probably will see some, but we're hoping that it will be relatively modest.
Okay. So again, best thing that we as colleagues here in the hospital can do.
Yeah. So we know everyone's tired. I'm tired. We'd like to be moving back to something that is more normal. But yeah, Terry is demonstrating that masks work. So all of our things that are called non-pharmaceutical interventions. These are things like wearing your mask, appropriately keeping your distance. We have some options this year that we didn't have last year. So, of course, still appropriate to keep those gatherings small, to keep masks on whenever we're in larger groups or around people who may not be vaccinated. But, what are some things that we can do to keep, our gatherings with friends and family over the holidays safer? So, of course, people should be really vigilant about their symptoms, keeping those small whenever feasible. But rapid testing is also now an option. And, it's pretty easy for everyone to, go out and get their rapid antigen test and, do that a couple hours before getting together. And so that is another option that can, help make those things a little safer. Rapid antigen testing is not perfect. So we don't want anyone to think that that replaces all the other things that that are helpful, but it's another tool in the toolbox.
Thank you, Lisa. Our Chief Medical Officer, Luke Day, just dropped a comment into the Q&A. A reminder that staff can drop into the back of the cafeteria Wednesday through Friday, 7:30 a.m. to 4 p.m. for both COVID boosters and flu vaccine. No appointment needed, just come and get your shots, flu
Yeah.
and COVID booster.
And particular thanks to Luke for reminding everyone about influenza vaccine. You know, there are concerns this year. We and everyone are really lagging behind in terms of, you know, last year everyone was very scared about a twindemic, and everyone got their influenza vaccines. And because we were all doing such a, you know, great job masking and distancing, you know, we really did not have an influenza season last year. This year is going to be different. We have seen many viruses on the rise over the summer, including RSV and other viruses. And flu is already here. We have seen cases in outpatients and one case in an inpatient. So, so please, 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 in addition to getting your COVID booster, wearing your mask and doing all the things that we know how to do, get your flu shot as well.
Great. So Lisa, hang on. We're going to switch gears a bit, but I know there'll likely be more questions coming up later. So can we go to Terry to talk about, as Susan said, we've got tons of work happening on our campus. Terry, what have you to say?
Good morning, everybody. I'm going to do the capital project presentation, which primarily focuses on the bond efforts. Let me share my screen. You should all see the monthly construction update for December on the screen now. It's a beautiful shot of our campus. Brent, I'm not sure if I'm allowed to use that. Moving on to the public health and safety bond projects. Now, these are just the bond-related projects. They're not the projects that have other funding sources. So in construction, we have moved on to the phase 2 of the rehab relocation. We're still trying to close out 6H surge office space. I will be talking about that. Dialysis relocation is getting started. Public health lab relocation is getting started. Clin lab automation project is getting started, and we're into the PES early demolition in the 1E area. Projects that we're working on in design is our IT infrastructure project. These projects, with all the delays and COVID and supply chain issues, we're seeing a lot of the costs go up. So we're looking at areas to reduce scope and VE and do things less expensive. So that kind of goes for all the projects, but definitely the IT infrastructure project, we're looking to reduce the cost of that project. Seismic retrofit is actually should be up in construction. Why is it down here? I do not know. I will be changing that. We're deep into the seismic retrofit. We have been, so it belongs up in the construction zone. Family Health Center in design, Building 8090 Specialties in design, Psych Emergency Services relocation is getting, not to be confused with the early demolition above. This is the actual build out of the Psych Emergency Services. That's actually in the final stages of its design. We're working on a fire alarm infrastructure design package and electrical infrastructure package. And of course, we completed previously the adult urgent care relocation and poison control. Pretty soon, we're going to have rehab down here in the completed section. Speaking of which, on the 3rd floor, we have the construction portion is complete, but we're still in fit up. We're still in transition. We have not completely relocated yet. That's going to happen early in 2022. Right now we are preparing for a licensing survey, which has not been scheduled yet. I did speak about the middle corridor last time being opened up. But we do have occupancy of rehab, and as you can see from the pictures, we're bringing new equipment in there, as well as preparing once we do the transition to bring existing equipment in. So hopefully by next time we talk, I'll have a scheduled time for the survey. But we are expecting to moving in very early in 2022. Dialysis relocation project is going to turn into its own slide since we're starting, but right now we're just doing some early work, nothing too sexy there, just doing some layouts and figuring out where the tendons are in the slab and moving forward with that one. Back to the corridor opening, again, we opened up the middle corridor. If you had a chance to walk it, I think you'll find it pretty nice compared to the walk around on the third floor, which actually is closed over on the south side there, because that's where the phase 2 work is happening. And this is a picture of it. Ta-da! Moving on to the 6th floor, I've been showing these pictures for some time. We're really trying to work on this fan shutdown requirement that was an 11th hour request from Oshpod. So we hope to get that completed and also an early occupancy in Q1 2022. Now for something special, we got our patient safety mezzanine, and I was trying to do some sort of animation with confetti, but I couldn't figure it out. So we'll just get a little. It didn't happen, did it? Oh, anyways, I was trying to get this to spin like that or something to make it exciting that we have the mezzanine all pretty much done for all. I'm doing some punch items, but it's for all intents and purposes, it's complete and in use. So enjoy. That was actually a safety project. Moving on to the seismic retrofit, which is in construction. It's not in design. We have completed the various external element cuts of the south side and also reinforce certain columns. Additionally, on the lower end of the west end, we've worked our way around where you see the green here in front of the someone labeled this the OPD lobby. That's wrong. That's the main lobby. So we have work done by the old cashier's office. We did some work over here by where phlebotomy is now, and now we're moving on to the one end. We're trying to work around their schedule and do a cut or two a day, but we're basically making cuts and reinforcing some of the work in that area. So we're working around the building. Soon you'll start seeing some scaffolding so we get to higher levels, and areas that are impacted will be notified as we move on. We are doing a lot of work in the pharmacy area, which is why the corridor is shut down, and we're wrapping people around the 1C corridor down this way to get to the OPD lobby. But we're actually digging down deep and reinforcing the actual footing of the building in that location, because this entire section needs to be strengthened all the way up and down the building, because this is actually where there's a separation. This M wing is actually a separate building from the main building, and that's why we're concentrating on this space and strengthening it. We continue to work on other projects beyond the bond projects. We're going to be replacing the chillers. We've installed auxiliary chillers to help us through our heat season. The wild smoke preparation could probably go away now that we're in winter, so we'll be editing that from this slide. But that's pretty much the update for capital planning. And I do not. The next slide is the UCSF research building. Has Ken Humphreys joined us? I don't think I saw him on.
He's on. He's on.
Oh, he
I'm
is?
right next to you.
Okay. Okay, super.
I'm gonna poke you.
Okay. Are you, do you want me to leave the slide up or do you want to put your own slide up?
I will share my screen if I can.
Okay, I will stop sharing my screen. There you are. I see you.
This is a different system, so I don't even know how to do it. I'm sharing. Oh, there. Now it works. All right.
There you go.
Oh, look at that.
So welcome everyone. Happy holidays and all that fun stuff. Happy new masking regulations. So I'll start off by just showing you the rendering again with all the beautiful terracotta that is currently in Italy, because you mentioned supply chain issues and you can't get containers right now. So we're having a hard time finding containers to put the terracotta in to get out here, but we're working on that. And I thought I'd show kind of a cool view from the top of the scaffold over on the south side, taken on Saturday. Beautiful sunset. And our roofing is going down. Super exciting after the last couple days to have the majority of the roofing down. So we're getting dried in really well up there, and we're taking advantage anytime we have a little bit of dry weather and really attacking it. One of the other things you'll start seeing is we actually were approved for solar, so we're going to be putting PV panels up on the roof. So that's official. The Executive Oversight Committee for UCSF approved that last week. We already have a design in place in preparation for that, and we'll be having about probably a third of the roof covered in solar panels. Pretty exciting. And this is a familiar sight to many of you, the north side of the building. What we're doing now is caulking the joints, stuffing baccarat and caulking the joints between the prefabricated panels, making sure that everything's watertight. We'll do some random testing and then start putting the support clips for the terracotta and metal panel up on the side of the building all the way around. And just for fun, I thought I'd share that last Thursday we had a safety lunch for the crews. And what we do is every quarter that we have no recordable incidents, we have a safety lunch to celebrate the safety. To date, in the past year and a half on the project, we've had one recordable, and I'll say it's a minor recordable because it was just some debris that blew with a gust of wind into somebody's eye. But we did have to have a little piece of metal pulled out of his eye. And the thing that made it a recordable is he got a prescription for some antibiotic ointment. So just because he got that ointment, that made it a recordable. So as a recordable incident, as those go, this was pretty mild. The next level is a missed time incident, and we've had 0 on this project with all the man hours. I think we're approaching 150 or exceeding, I think now 150,000 man hours on the project. So the team's doing a great job. And that's all I've got.
Yeah, I think our campus became aware of this luncheon
That's correct.
because of smoke.
Yeah,
Yeah.
and I wasn't there, and I heard that we adapted and relocated to make sure we were out of the way. And lesson learned: when I set up a location, then go to a meeting and find out that we set it up somewhere else. So apologies for that one.
No worries. No worries. After the initial panic, everything was fine, Ken. So,
Ken,
oh, sorry. Go ahead. Go ahead.
Let me ask the question. Ken, we're seeing a lot of scaffolding around the entire building. Can you explain what the scaffolding's purpose is?
Yeah, the scaffolding right now, it's just for the exterior skin system. The contractor thought it a much more efficient way to put the baccarat in, the caulking, actually put the support clips, and then eventually the terracotta. these terracotta panels are pretty big. Handling those off of a high lift reach was the biggest problem. If it wasn't for the terracotta, we probably would have done it all off of lifts. But after working on the mock-up, they realized just how heavy these things are. And so we were hoping for no scaffold, but we ended up with scaffold.
Thank you.
So while you're both you Ken and you Terry are plugged in and on the line, are there going to be any kind of upcoming moments when our staff would hear a lot of noise or experience dust or anything like that from either the capital bond work that you were talking about, Terry, or Ken, the work left to do on the research building?
Yeah, I'll take that. So with the skin of the building on the research building, a lot of the noises are going to be on the other side of the skin. So we're getting a lot of natural shielding from that, and as it gets more advanced with the tile on it, it'll be even more solid. So we don't expect a lot of noise coming from the RAB. I think we've been through the worst of it. Not so with building 5. This morning there was some work associated with the rehab phase 2 work, which was on the south side of the building where they had to chip out a sink basin, and that created a lot of noise between 6 and 8. We're going to try to do our best to identify those as early as possible and get the word out as early as possible. My phone did not ring, so I'm hoping that means that there wasn't an issue this morning, but I'm sure I'll learn more about it after this presentation. But there will be work in the building where we are saw cutting and chipping and drilling anchors into columns, and that's going to happen all around the entire building at different times over the next couple of years. If you're walking the floors and you see tape on the floor, and that's where we're kind of masking out or identifying where we have tendons in the slab, those are going to be areas of work that will probably create noise at some time. We're going to work with the adjacent areas and notify them and make sure that we schedule it at a time that has the least impact, but it will not be no impact. So we can expect that. And then of course, with the future projects, we have public health lab in the basement, and we got the next one is the dialysis on the 3rd floor. Those are going to be the next 2 active project areas. They'll have their own associated chipping and drilling and sawing and cutting that's going to have noise at times. And again, we'll work with the adjacencies to work around. But again, it won't be no impact.
Right. And in the event that there's kind of noise which might not be tolerable or something like that, who can staff reach out to kind of talk through those issues?
Yeah, we can advance. You can advance it through the construction hotline. I think I. Let me just see. I seem to have lost that slide on my presentation. I'm going to have to add that to my presentation so that people do know who to call. But I believe that if you go on construction updates, there's a number there on the Inside CHN page. We will be posting notifications with phone numbers in the areas that we are doing that work.
Okay, thank you so much. The other question for you, Terry, what's changing in the new PES? Like, what's different new PES versus?
Well, that's a very good question. We're making it larger, nicer, more efficient. The day room, if I don't know who's listening, who's had a chance to tour the current PES, but it's overcrowded. It's got a small day room. It does not have a central observation area. So the new design is going to have a day room that's 3 times the size of the existing day room. It'll have a nurse station that has kind of 135-degree view of the space, as well as expanding the isolation rooms and making more space for the staff to do their charting. So it has a lot of benefits over the existing PES. So it's going to be relocated to where the old ED was, Zone 1 and Zone 2, over on the east side.
Great. Thank you so much.
Sure.
Susan, you've been sitting here quietly, listening and observing. What is on your mind today?
Yes, well, thank you for that. So first of all, I want to really thank our presenters this morning, Lisa, Terry, and Ken. Ken, I especially want to call you out for your attention to safety on your project. That's a really important topic for all of us, and I know how observant we are about safety and working on how to, prevent any accidents or harm to our patients, staff, or visitors. But I appreciate you calling that out. Just an observation, I always expect to learn every day about medicine and clinical care, but I'm always delighted by learning things, that I'm surprised about, like capital projects. I have learned more about capital projects and building recently, and it's great, and I really appreciate your talent and expertise in those areas. Just a couple things, late breaking news. San Francisco just hit 80% of its population fully vaccinated. So I want to congratulate all of us on that amazing milestone. As all of you know, Zuckerberg San Francisco General has played a huge role in that milestone. So congratulations to us. It will be tomorrow that we celebrated the very first vaccinations in the city, right here on this campus. And so think about that. We've gone from 0 a year ago to 80% of our population being fully vaccinated. That is major cause for celebration. I just wanted to also comment on the hospitalizations, just by sharing a tiny piece of data. So as of a few days ago, there were 34 people hospitalized in total in San Francisco. Compared to a year ago, I don't know the exact number, but it was more than 34, and we were seeing a rapid rise up to our third peak, which was by far the largest peak that we had, of 256 people hospitalized in San Francisco. So right now we're at 34. It appears to be kind of flattening. We don't know if it'll probably go up from here, but it doesn't appear in any way, shape, or form to be, going to that 256 or anywhere near there. So with that, I just wanted to thank presenters again. Thank you to Brent and Christina for organizing us this morning. I want to wish all of you a very happy, safe, healthy, joyous holiday. And if there's anything you need or any escalation or questions, we're here for you.
Thank you, everyone. I hope you all have lovely holidays. I hope you get the opportunity to take some time off and be with your families and friends, and keep it safe. And we will see you all next year. We will see you in January. Bye now.